Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Fainting happens when your brain doesn't get enough blood and you actually lose consciousness temporarily. And the medical term for fainting is syncope.
Oh.
Syncope.
All right.
You know that?
I did not. I always just say fainting. And it's usually completely benign, no big deal. Some people faint at the sight of blood. I might know someone who falls into that category. Fainting can even be caused by emotional trauma or stress.
But in some cases, the cause can be a serious disorder, often involving the heart.
Joining us on the phone to explain why people faint is cardiologist Dr. Win-Kuang Shen. Welcome to the program, Dr. Shen. It's nice to meet you.
Thank you so much to both of you.
And Dr. Shen is from the Mayo Clinic in Arizona. Hey, how's the weather down there? No, don't tell us.
We don't want to know.
Yes.
What is happening when someone faints? What's happening in their body?
As a matter of fact, just as I heard your introduction, that was precisely what happens is that when the brain does not get enough blood supply, a person loses consciousness. So that is the common mechanism why a person faints. And then I'm sure we're going to talk a little more about what conditions that may be making that happening. But the bottom line is that when there is no blood or insufficient blood goes to the brain, a person faints.
And that can happen under emotional trauma, or if you see blood, that can decrease the blood that goes to your brain.
That is actually a very common occurrence, whether in the young people or in the older patients. Essentially, is that when there is an emotional trigger, and the body usually, when a person is upset, or let's say a person is very excited, and usually what happens is the heart rate goes up, blood pressure goes up, and so the body, that's the normal physiology to excitement. But what happens is that the brain actually sees that, and the brain says, look, you don't have to be so excited, and let's slow down the heart rate, let's lower down the blood pressure. So that reflex sometimes goes overboard, and the patient ends up with the low blood pressure or a low heart rate. The combination of the two leads to insufficient blood supply to the head, especially if the person is in the standing up position. It happens less so if the person is in the flat position or sitting.
Perhaps if someone is watching his lovely wife give birth to their beautiful child, that might be a reason why they would faint.
Absolutely. Actually, I have seen that. Yes.
Yeah, I have too.
But that is fainting with minimal consequences. It's temporary. But there are other kinds of fainting spells that concern you, correct?
Absolutely. And that's where really that takes a physician or a healthcare provider who really have the expertise and to differentiate the clinical characteristics of benign fainting, like what we just spoke about, and differentiating those conditions from potentially life-threatening conditions that causing fainting.
So how do you figure it out?
History, and history.
And sooner or later, if you talk to the patient long enough, they'll tell you what's wrong with them, right?
As a matter of fact, the statistics and a lot of clinical studies have suggested if the experienced healthcare provider knows what questions to ask, and about 60 to 70% of the time, you pretty much can nail the diagnosis after the history.
So what are some examples of heart problems that can cause serious fainting spells?
Okay. Well, as always, a prior history of heart disease. So, for instance, if a patient has had a prior history of heart attack, a patient has had a history of cardiac surgery for valvular structural heart disease, or if a person has had some rhythm abnormalities. And also in patients with reduced cardiac function, these are the clinical characteristics and history put the patient at a higher risk for cardiac causes of syncope as compared to the benign causes. and that causes. But now there are also other features. So, for instance, somebody has chest pain or palpitations prior to fainting. That's important. And then one of the features is always if a person has a fainting spell doing physical activities, not after, doing physical activities. Let's say doing running, jogging, and it would be very unusual to have a common benign fainting, and usually we pay a lot of attention to if a person has a fainting spell doing exercise. So these are some of the characteristics we're looking for when we take a history with the patient.
Why do I feel faint sometimes when I stand up too fast and not others?
Yes, and that's also a very common occurrence, is that just think about when we are sitting and the gravitational force is somewhat reduced of pulling the blood that to the legs because you are sitting. When you suddenly stand up and it requires a certain amount of blood pressure to push the blood to the brain. And when you stand up, gravitational pulling of the blood and to the lower body, that is less than when you are sitting or when you are in a flat position. So momentarily, it is not uncommon for a person feeling a little bit of lightheadedness that when a person quickly stands up. But normal physiology is always that's able to compensate that. So most of the time, patients don't faint other than feeling a little bit of lightheadedness when first standing up. And also, I may add two things. One is that in older patients, that especially on medications for hypertension and other medications for heart disease, often they lower the blood pressure. And so as a result, that those patients are more prone for fainting. And then another group of patients would be patients with long-standing diabetes. Their nervous system, the autonomic nervous system, may not be able to provide as a strong compensatory mechanism to try to get the blood returned to the heart and the brain. And so those are, again, clinical characteristics we're looking for.
When the history tells you that there might be a heart problem as an underlying cause for the fainting spells, what do you do next? How do you confirm that there's a problem with the heart?
So what we've suggested with some of the evaluation that we think that really as a routine and guideline-based recommendations beyond the history and physical examination, an electrocardiogram is important. Electrocardiogram can tell us a lot of different information, the rhythm, or if there's any prior history of a heart attack. And then beyond that, it should be very based on the clinical presentation. So, for instance, if during your examination, the patient has a heart murmur, on the electrocardiogram, it suggests that the patient may have some heart disease with the abnormal ECG. And then that's the time that we would consider, for instance, doing an echocardiogram, ultrasound picture of the heart, that we can see the structure of the heart, we can assess the cardiac function. And then if the patient you suspect to have some rhythm abnormalities, you may put the patient on a Holter monitor or some prolonged monitoring to assess the rhythm abnormalities. And then, of course, there are some more fancy type of studies, but they should be very individualized.
We have about 30 seconds left to go.
Yeah, we want to ask you just one more thing. We've learned a lot about fainting that we didn't know before, but one more question, and that's tell us about psychogenic pseudosyncope.
That is yes, it's a very unique patient population. These are the patients who perceive or they feel and they present as fainting as an emotional reaction in the absence of any documented rhythm or blood pressures.
So they can make themselves faint?
They make themselves faint, and yet without a physiologic explanation. And this is a tough group of patients, and require a lot of counseling.
They're like those goats, the fainting goats. They just faint.
That's correct. Yes.
All right. Well, thanks so much, Dr. Win Shen, cardiologist, heart specialist from the Mayo Clinic in Arizona, on why people faint. Really appreciate you being with us.
Thank you both.